Good morning, everybody. So, your host for today, on today's webinar, will be myself. I'm the iPlanet Client Director, and we'll be joined shortly by Lisajane, who is our International Client Director. And we'll just be discussing the topics and giving you a quick demo of how we can address some of those issues raised. Okay, so just as a quick introduction of what we're going to be talking about today. So we're looking at mobility and versatility and what that means. So we'll have a look at what the current challenges are in social care, particularly in the operational side of social care providers, in response to various issues we've had recently, discussing what do we mean by versatility, what do we mean by mobility, and what is the role of technology in addressing some of these issues and facilitating these ideas, these concepts. So we start off with we'll have a look at what are the challenges that social care providers are starting now. Well, obviously, I think the most obvious one at the moment has been the COVID-19 pandemic. It's had a real impact on operations. We've had staff absence due to quarantining or illness. Service users have experienced have a real impact because they've had disruption to their routines, an element of isolation, and the effects that can have on mental health. And also, although there's been a shift towards more dynamic ways of working in the social care sector over the last few years, it's kind of been forced on people. The remote working idea has been forced onto providers, whether they were ready for it or not, because people can't go into their offices. We've had reduced workforces and restrictions are in place everywhere. We also, of course, have the issue of chronic underfunding. My own experience as a registered manager and as a regional director, we were always fighting funding in the social care sector. This can have a real effect on quality in some places. I'm sure we're all aware of as you drive down the fees for care and the funding for care, then people, some organisations are either forced or choose to cut corners in training, but also how you monitor, how you organise your services. And some of those traditional models are actually becoming unviable, particularly in the home care sector, but in domiciliary care sector, in aged care, but across the board with learning disability support, autism support, mental health support, etc. The traditional ways of working just can't be supported by the funding issues that we have in the sector. The knock-on effect of both underfunding and the pandemic is affecting recruitment and retention. We've got an exhausted and stressed workforce at the moment, very disillusioned. Some of the feedback I've been getting from former colleagues and from our customers at the moment, and it's really difficult, from losing a lot of talent, both from support workers all the way down to directors and managers. And there's a real lack of empowerment, I think, on the frontline workforce in particular. Feel very, they're not able to get involved and affect services as much as they would like, and the same goes for managers as well. I think everyone's hands feel very tired at the moment. And of course, we've had as people look to move to new ways of working, as they look to find how they can adapt, a lot of providers are still using paper-based systems or forms-driven electronic systems. And so these legacy systems aren't really inclusive, not really dynamic enough to deliver services the way that we would all like to. We're ultimately all here for service user outcomes in their life. So let's have a look at, if we're looking at versatility and mobility today in terms of operations, how can we react to these challenges? Well, what do we mean by that? So versatility is really about how care and support is delivered, how care and support is organised, how care and support is monitored, and it's about being adaptable to different environments. So that environment, you may be running services in supported living, you may be delivering services in day centres, you may be delivering services in a community setting, but you still require the same level of operational quality and also service delivery quality, regardless of which environment you're working in. Mobility is more about where that care and support is delivered and how and where it's organised. So it's about portability between environments. So let's say You know, in one day, in one particular shift, working with the service user, you may start off in the service user's home. As you go through the personal care and medication routines, you then may go into the community with that service user for community activities, more outcome-based activities. You may then be in an educational environment and then visit the service user's family, all in the same day. So your versatility really transforms itself into mobility in that respect, because you're changing. You're not just being able to work in different environments, but actually going between those environments at the same time. But the common factors that apply to whether you're looking at versatile or mobile services are communication is key. You need to ensure that your service delivery remains effective in all of those environments. And obviously quality and compliance are still at the forefront of everyone's mind, as I'm sure, from support workers to managers. But really, and ultimately, however providers are organising their operations and their service delivery, we have to make sure that we're maintaining service user inclusion and that we're maintaining that person-centered approach to what we're doing. So what's the role of technology in achieving those aims? So with technology now and more modern dynamic systems, and obviously this is a webinar for Asperico, so we'll be looking at iPlanning shortly, but moving on from legacy systems and older ways of working, you have data-driven quality and compliance. So the recording that you're doing, the monitoring that you're doing, you can drive continuous improvement through using data. You have real-time live monitoring of your services, so you can identify issues, you can fix problems, you can organize your operations effectively, and you can be responsive to operational changes. Technology supports improved communication. I think back 10 years ago, 15 years ago, people were still, not everyone even had a mobile then, but now, we have messaging, email, all different ways of communicating, which technology can then support. Technology supports that adaptability, that versatility to working in different environments. And cloud-based systems, now the cloud is releasing people from their desk. You don't have to be at a computer to update a care plan, record your notes. You can do that from a number of devices. By being able to do this, you're actually empowering the workforce as well. So your frontline staff, with access to support plans, can actually be actively engaged with service users and their families and their circles of support in developing support plans as they go. I mean, our frontline workforce see service users every day. They should really be the key of driving that, driving how we develop our services, and technology can really empower them to do that. Technology brings cost efficiency as well, as we're all under tight budgets and that chronic underfunding, but the technology can pick up a lot of the heavy lifting of organising and monitoring the services, taking away, even down to practical issues like having to drive around to collect paper-based plans, things like that. But on a much wider scale, you can adapt much more quickly, and that's far more cost efficient in organising your services. And technology as well promotes that ethos of inclusion and co-production with our service users and with their families and circles of support. So, as we said, when we're looking at technology, we're going to have a little look at iPlanet. How does iPlanet meet these challenges? How can it make provider operations more versatile and more mobile, as we discussed? And how can it improve communication? How can it improve policy? How does it support inclusion?